In this video, I'll be showing you how to prepare for the Exercise 5 Skeletal System Lab you'll be completing this week. I would highly recommend logging in to Connect to use some of the resources that are available to help you prepare. First off, you should open a copy of your ebook as well as a copy of APR. In the ebook, you'll go to Chapter 8, and in the very first section of Chapter 8, you'll see Table 8.2 right here. This gives you the definitions of a series of anatomical features and markings you'll be finding on the bones of the axial and the appendicular skeleton. Keep this table handy, either by printing it off or bringing your computer with you to lab, so you can learn the structures a little more quickly and you can understand exactly what details they entail about each part of the bone. In this tutorial, I'll show you how to identify these structures using APR, and I think this will be a valuable tool for study before and after the labs that you cover. Of course, you'll want to select the skeletal system module and the dissection tool. If your instructor has given you a My Course code to look at the specific material that we'll cover in our class, you can enter that at this point in time, or you can choose the All Content section. I'll be using that for this tutorial. So your exercise starts on page 13 in the lab manual. The first thing you'll notice on page 13 is that we differentiate between what's called the axial and the appendicular skeleton. So just to show you the borders of what each one of these would be, appendicular skeleton is where, of course, what its name sounds for. It's the appendages for the arms and the legs, as well as what are known as girdles. This would be the pectoral girdle and the pelvic girdle. The axial skeleton, which we will be focusing on during the first week of study, is comprised of the skull, the vertebral column, this of course includes the sacrum and the coccyx, and the thoracic cage, which includes the ribs and the sternum. We'll be naming all of these bones as well as the individual bone markings for each one. Keep in mind, if a bone is duplicated during study, you must identify the right and the left version of the bone. You'll be looking at a combination of articulated skeletons and disarticulated bones. Those that you'll be studying are real human bones, and you must treat them with extreme care. Keep in mind that you should never use pencils or pens to point or identify structures on the bones, but instead use the tools that are provided in lab. We'll begin by looking at the skull. So right over here you can see where it says skull and associated bones. And the view that you'll choose to begin with is anterior. It'll show you attachment sites that are here on the skull and the other bones that we'll study, but you will not need to identify those. So you can either choose to scroll down on attachments to eliminate them, or once you begin clicking on individual structures in the bones list, it will eliminate those altogether. The first thing we'll examine is the cranium. So the cranium itself is going to be made up of a series of bones that include the frontal bone, the parietal bone. Here's the frontal bone right here, as you can see, and you can see where it places on the skull. You can also choose things like other views to show you different views of where the bone sits. So here you can see it complete with the head and the torso. And here this sagittal view. We're going to focus on this lateral or sagittal view for just a moment. You can see right here where the frontal bone ends, and that's actually where it's going to make contact with what is called the parietal bone. So we'll go back to skull right over here in the lateral view, and we'll highlight the parietal bones. The parietal bones are there. The occipital bones sit at the very most posterior portion, and the temporal bones sit right beneath those parietal bones. These bones are all joined by what are called sutures, and the sutures themselves have names that are not correlated with the bone themselves. So even though you'll be identifying bone markings for each bone, the sutures themselves are their own entity. So of course you can see the squamous suture that lies between the parietal bone and the temporal bone. Up here you can see the lambdoid suture, which lies between the occipital bone and the parietal bones. You can see the coronal suture here. And if we change the view to look at the superior portion of the skull, right on the very top, you can see the final suture, the sagittal suture, dividing right from left. The very first bone that it mentions in your lab manual is the frontal bone. So we'll go back to the anterior view, and we're going to pick the frontal bone. So let me use this to explain to you what we mean by bone markings. One of the bone markings that you'll see on the list of frontal bone structures is called the glabella. The glabella itself is a region of the frontal bone. The way you need to practice identifying these in lab is to refer to this as the glabella of the frontal bone. There are other structures that are like this. We'll scroll down the list to find the supraorbital notch. This would be the supraorbital notch of the frontal bone. Of course, we'll want to be specific, so this would be the right supraorbital notch of the frontal bone and the left, as you can see right over here on this side. You will not be learning the functions of these structures in lab. You will learn them in lecture. For now, it's helpful sometimes to recognize what the directional terms mean. So for example, a notch or a foramen tends to be a groove or a hole. In our case, this is where nerves and blood vessels tend to pass through. Again, keep table 8.2 handy as you go through and you identify these different structures. The ones that will give you the most trouble in this lab are the many foramina, or multiple foramens, the many foramina of the skull itself. Most of those can be seen on the base of the skull, so make sure that you get a good idea of where they're all located before you make it to lab. That way it reduces some of your confusion. A few of the structures that I do want to highlight are some more of the bones that form the cranial cavity. Let me show you here the sphenoid bone. So as you can see from this anterior bone, the sphenoid bone can be viewed in a number of different places. It can be seen here on the lateral sides of the cranium, as well as forming part of the orbital cavity where the eyes are going to fit. We're going to choose the other views option here so that you get a better idea of where this sphenoid bone sits. So when we looked at the temporal bone, parietal bone, and frontal bone, the sphenoid bone was going to be bounded by each one of those. So this would be the right side. You can again see it right here, forming a portion of the orbit. Here, when you look at the inferior view of the skull, you can still see it stretching from right to left. And of course, when you look at this mid-sagittal view of the skull, where the skull has been cut in half down a sagittal plane, you can still see that sphenoid bone making up a large portion. The sphenoid bone itself is often called the butterfly bone because of the fact that it has what looks like wings. Now they are called wings. We'll call this the lesser wing on the left, the lesser wing on the right, and here's the greater wing on the right and the greater wing on the left. So you get an idea of where it's going to get its representation. By itself, the sphenoid bone has a number of foramina that you'll be identifying, as well as a number of processes. We'll go to this view so that we can study what some of these processes are. We're going to focus on what are called the pterygoid processes. So there's a medial and a lateral pterygoid process. Both of these are going to project downwards. If you want to see these from another representation, you can see how they're going to project in the inferior view right here, right along the line of the upper level of your teeth. These serve as attachment sites for muscles. If you go back to this image, sometimes you can liken these pterygoid processes to the feet or the talons of a bird. So if you think of this as an eagle or a pterodactyl, then these would be its foot-like processes. Sometimes that can help you with the orientation of the bone itself. Another bone that can be confusing to identify is called the ethmoid bone. So we'll go back up here to this main list and we'll pick ethmoid bone. And the ethmoid bone itself, if we were to pull it out, is going to look almost amorphous in nature. Let's go ahead and highlight a point called the crista galli. Think of this as a horn on a rhinoceros. This is going to be its most superior portion, and it does sit anterior on the bone. And we're going to look for where this structure sits here in these views in APR so you get some orientation. So here's the crista galli itself. I'm going to go ahead and go to this particular view and highlight the entire ethmoid bone so you can see where it sits in this mid-sagittal view. So there's the crista galli right there, and this large portion of the ethmoid bone sitting right dead center of the skull itself. This particular region of the ethmoid bone is called the perpendicular plate that points right down. And that perpendicular plate helps to form what is called the nasal septum. So here you can see that perpendicular plate sticking straight downward. It's not the complete nasal septum. As you'll notice on page 14 or 15 of your lab manual, there is a bone right here at the very lower part that is called the vomer. I'll go ahead and highlight that for you so you can see it, and it makes up the more inferior half of the perpendicular plate. We will go back to the ethmoid bone for just a second so you can see a few more components. The ethmoid bone itself has a series of spaces that are similar to sinuses. We call them ethmoidal cells. And it also has a series of projections that are called concha. So this is the middle nasal concha. I'll show you where this sits in the skull itself. When you're looking through the opening of the nasal cavity, reminder that the only bones that are forming this would be the maxilla And the nasal bones here in the front, the remainder of which is going to be hyaline cartilage, which is no longer present on the skulls we look at, so you can see straight through into this nasal cavity. These would be what we call the two middle nasal concha coming off of the ethmoid bone. There is another set of nasal concha. We'll go down here. They're referred to as the inferior nasal concha, but they are not actually part of the ethmoid bone. You'll actually see their names on page 14 of your lab manual. Do not refer to them as part of the ethmoid bone. Now, each one of these is responsible for actually creating turbulence in the air that you inhale through the nasal passageway. This is going to warm the air, filter the air, and create moisture in the air that you breathe in. And the air hits those structures and begins to circulate in spaces that are named for them, and these are called meatuses. Now, these are not identifiable here in APR, but they are one of the structures you're responsible for in your lab manual. So a meatus, it looks like the word meet us, but it's pronounced meatus, would essentially be the space beneath the inferior nasal concha. So it would be the inferior nasal meatus. And again, if we go back to the middle nasal concha right here, the middle nasal meatus would be below that. Now, there is a superior nasal concha, but it sits higher up, and you cannot see it here in APR, but it is also a part of the ethmoid bone. We're going to change views here, and we're going to go to the skull, what's called the cranial cavity. Now, what we're looking at here is we've removed the top part of the cranium, and we are looking down into the floor of the nasal cavity. This is towards the forehead, this is towards the back of the head, and we're going to once again click on the ethmoid bone. Now, the ethmoid bone itself right here, we first identified that rhinoceros horn called the crista galli. So here's the crista galli right there. One of the structures that confuses students is on either side of this. This is called the cribriform plate, and it's a flat plate that is part of the ethmoid bone and exists on either side of the crista galli. You'll notice that it's perforated in appearance. These perforations do get a name. They are called the olfactory foramina of the ethmoid bone. So as you're naming these individual structures, keep in mind that our terminology in our questions will lead you towards the structure we want you to understand. If we want you to identify the entire cribriform plate, we'll ask for that entire surface. If we want you to identify the olfactory foramina, we will point just to the tiny little holes that you see right there and include in our question, identify these tiny holes. So just to give you some orientation here as you're looking at this view, we can go back here to identify the frontal bone. You can see right there at the very front. You can see the sphenoid bone. You can see the temporal bone on either side, the left temporal bone, the right temporal bone, and you can see the occipital bone. Now, as I said, there's a number of foramina that you will be identifying here in these structures. So let's go ahead and take a look at a few of those. You'll see first off right here what's called the foramen lacerum. The foramen lacerum is going to be a wide opening. It looks almost like a laceration instead of a fine hole, and that might help you to remember what its name is. There are no blood vessels or nerves that actually pass through this. Instead, it's filled with a connective tissue. You also see the foramen magnum. Foramen magnum is one of the easiest to identify foramina that we see. This is where the spinal cord is going to pass through. The foramen ovale tends to be a nice oval-shaped hole, and the foramen rotundum tends to be a nice round hole. The spinosum sits to the lateral side here of the ovale itself, and the way that most students tend to remember the order of these holes is they use the mnemonic SOLR, S-O-L-R, and that goes for spinosum, ovale, lacerum, and rotundum. These are not the only foramina that you'll be identifying. You can also see what's called the hypoglossal canal of the occipital bone, right down here. The internal acoustic meatus that you see right over here. And the jugular foramen, the left jugular foramen and the right jugular foramen, sites of the internal jugular vein. Let's change views right here. We're going to go back to the skull, and we're going to look at the inferior view. And you can highlight some more of these individual foramina. Let's go back to a few that you've already identified. Here's the foramen lacerum, again that laceration of the sphenoid bone. Foramen magnum, the nice open hole here at the base of the skull. Foramen ovale, still nice and oval shaped. Foramen spinosum. You'll notice there's no view of the foramen rotundum here as it's going to project forward and not downward. You can see the hypoglossal canal, once again here, opening into the space that would create the foramen magnum, and the jugular foramen. Very large holes there. One of the structures you can also usually see in this view is the carotid canal. And it doesn't seem to give me a view of this, so we'll go up to the incisive fossa, but essentially this little hole right here would be referred to as the carotid canal. There we go. So this little hole right here, carotid canal and carotid canal. The last fossa that we see right up here at the very top also can be referred to as a foramen, but that's going to be a part of what is called the maxilla. So we're going to let that go ahead and take us to the bones of the face, since the maxilla is considered one of the facial bones and not one of the cranial bones. We'll go back to our anterior view right here, and we're going to pick maxilla. As you can see, this bone sprawls across the majority of the face. It's bordered on the lateral sides by what's called the zygomatic bones on the left and on the right for your cheeks. And then inferiorly, you can see it's going to form a joint with the mandible or the lower jaw. There will be more foramina that you see with each one of these, and what we refer to as processes that come off of each one. These tend to confuse students, so I'm going to run to the lateral view here, and we're going to highlight the zygomatic bone. You can actually take a look at the zygomatic bone in your lab manual if you'd like to follow along with this pattern. It can be seen on page 15. There are three processes on the zygomatic bone that you'll be naming. The temporal process of the zygomatic bone can be seen right here. And let me show you how this is named. Even though this is a process of the zygomatic bone itself, and you can tell because it's on the anterior side of this tiny little fissure or suture. That is the dividing line between the zygomatic bone and then the temporal bone. Again, I'll highlight that so you can see his borders again, the temporal bone right over here. All right, so the zygomatic process of the temporal bone, the temporal process of the zygomatic bone right here is the part of the zygomatic bone which most closely borders the temporal bone. So it is the temporal process of the zygomatic bone. We're also going to look up here for the frontal process of the zygomatic bone, and they don't have it on the list, but the frontal process of the zygomatic bone will be this process that you see right here. And you would also see the maxillary process of the zygomatic bone. Again, not on the list, but it would be this region right up here where it borders the maxilla. Let's go back over here. Again, this was called the temporal process of the zygomatic bone. The one that sits right beside it can often be confused, so we're going to highlight it for you. This is called the zygomatic process of the temporal bone. So as you could probably guess from the pattern I just showed you, it is part of the temporal bone itself. However, it's the part of the temporal bone that actually abuts the zygomatic bone. So once again, this is called the zygomatic process of the temporal bone. And then this was the temporal process of the zygomatic bone. You'll need to practice these quite a bit as you go through the bones of the skull. Again, I would recommend writing these out. That's going to commit this to memory a little bit better. As you go through, you want to make sure that you go in order of the list on pages 13, 14, and 15. The structures you'll be ending with today are the vertebral column, and then on page 16, the sternum and the ribs. So I'm going to show you how to compare and contrast the vertebrae that make up the vertebral column. And to do that, we're going to go back up to this main topic menu, and we're going to go to where it says vertebral column. So the vertebral column, again, is going to include the sacrum and the coccyx. I'll go ahead and highlight those for you. The sacrum is very large. It's 5 to 6 fused vertebrae. It's going to maintain a lot of similar features to the individual vertebrae that we'll be studying. And then, of course, you can see the coccyx itself. So about 4 to 5 fused vertebrae, much smaller than those that you'll see in the rest of the vertebral column. Cervical vertebrae themselves, there are 7 of these cervical vertebrae. There are 12 of the thoracic vertebrae, and you can use this to help you remember, there it is, that there are 12 pairs of ribs that will attach to these 12 thoracic vertebrae. And then there are also going to be lumbar vertebrae. There are 5 lumbar vertebrae. Usually we remember these by saying you have breakfast at 7, lunch at 12 noon, and then dinner at 5. Do keep in mind that you must know the names of the vertebra as well as how many there are of each. Now on the exam, we are going to give you individual disarticulated vertebra, and you must be able to identify them. So as we begin to look at these, I want to show you some individual vertebrae so that you've got an idea of what kinds of characteristics you'll see in each vertebra. On page 15 in your lab manual, where it says vertebral column at the very top, you'll see what's called the general structures found on each vertebra. So the first one you see there is the body. This is going to be made of spongy bone, and it's going to bear the majority of the weight that you're going to see on these individual vertebrae. And you're going to see what are called the pedicles and the lamina of the vertebra themselves. Now when you put these all together, they're going to form what's called the vertebral foramen of a particular vertebra. You'll notice in your lab manual that a vertebral foramen itself is for one single vertebra. But when you line all these vertebrae up together, the spinal cord passes through those, and that giant canal is called the vertebral canal. You'll also notice what's called the articular processes. So here you can see what's called the inferior articular process. This is a lateral view. This is where this particular vertebra is going to articulate or connect with a vertebra that sits below it. So it's an inferior articular process. And where it makes contact is with a flat pad called an articular facet. If I show you the superior articular process right here of that same vertebra, you can see in the view over here, a superior view above the vertebra, that it also highlights this surface on the top. So again, a process is a projection or a preeminent spot. The actual facet right here is just this flat space on the process where you'll see articulation occur. It's usually covered by a hyaline cartilage pad to reduce wear and tear during movement. So keep in mind the difference between a process and a facet as you look at each of these vertebrae. These two articular processes are not the only ones that you see. You'll also see what's called a transverse process of all vertebrae, as well as a spinous process of vertebra. So again, these are common characteristics that you will see in the cervical, thoracic, and the lumbar vertebra that you see. However, you do need to be able to determine the differences between each. So while we're looking at a cervical vertebra, I'll show you right here that the spinous processes of these tend to be bifid, which means they split kind of like a forked snake's tongue. You'll also see right here when you look at the transverse processes of a cervical vertebra that they have tiny holes. These are called the transverse foramina, and this is where you'll see spinal nerves begin to pass through. While studying the cervical vertebra, there are three that you actually need to know the names of. We'll go back to the vertebral column right here, and I'll turn on my labels. The top vertebra right here is called the atlas, or C1, and the second one is called the axis, or C2. We're going to go back here to the atlas and choose the other views tab so you get an idea of what this looks like. This is a very flat bone, and it has very large facets right here that actually adhere to the base of the skull at what are known as the occipital condyles. If we go back here to the axis, then other views right here show you that this looks a little bit different than all the other vertebrae. It has right here what is called the dens or the odontoid process. So there's the body, and the dens arises right off of that. So these two vertebrae are pretty recognizable when compared to others. Keep in mind that if we place those out, you must know them by name, as the atlas or C1 and as the axis or C2. If we move to thoracic vertebrae here, you can see some major differences. First off, the spinous process that's right here is much longer than what you see in the cervical vertebrae, and it's not bifid. Oftentimes when looking head-on at this vertebra, it looks a little bit like a giraffe's face. So I say giraffe, sounds like Jurassic, which sounds like thoracic. It may be a stretch, but it can help. You'll still see the transverse processes. And off of these, you have a facet that you won't find in any of the other vertebrae. It's called the transverse costal facet, and this is where the costal cartilage of ribs will attach. You'll still also see your superior articular processes with superior articular facets that come off the top, as well as inferior articular processes. There we go. Doesn't have it right here. Those are a little bit less pronounced from these particular views, but you should see them there. The last that we will see are the lumbar vertebrae. Lumbar vertebrae tend to have the largest bodies. So again, when comparing them, it's pretty easy to distinguish. And their spinous processes tend to be short and blunt. Again, you'll still see the superior articular processes as well as the inferior articular processes, and finally transverse processes. So I recommend getting each of these three types of vertebrae out side by side and comparing each one of them so that you can see where they are similar and where they are different. The last thing we'll move to here is the sacrum and the coccyx. You'll notice right here that they have some very similar structures. So you're still going to have surfaces where they actually articulate. So these would be the superior articular processes of the sacrum. So just like each vertebra had them, now the sacrum as a whole is going to have it. You're also going to see what's called the median sacral crest. This is essentially where the spinous processes would have fused. And then you're also going to see what's referred to as the auricular surface right here. This is where you're going to have the sacrum articulate with the bones of the hips or the coxal bones. And then, of course, the coccyx at the very base. You won't be identifying any bone markings of the coccyx. We'll end the discussion by looking at the thoracic cage right here. The thoracic cage is made up of the sternum, which has three parts. We'll learn about the manubrium of the sternum, the body of the sternum, and then finally what's called the xiphoid process of the sternum. You'll also see the ribs themselves. Right? There are 12 pairs of ribs, 12 on each side, and they attach via what are called costal cartilages. That's hyaline cartilage. It gives you some movement. There are three categories of these ribs. Now they are referred to here in APR as true, false, and floating, but on page 16 of your lab manual you'll see their more scientific names. So we'll start with true ribs. These are the first 7 ribs. These are actually referred to as vertebrosternal, named for what they attach to. So vertebro for the thoracic vertebrae at the back, and sternal for the sternum here. The next set that you're going to see are called false ribs here, but their technical name is vertebrochondral. Chondral is named for the costal cartilage that they attach to. And these right here are attaching to the costal cartilage of rib number 7, which extends down this way. Now, one thing you'll see here in APR is it highlights the last 2 ribs, and while they can be considered false ribs, we would rather you refer to them as vertebral ribs, noted here as floating ribs. These 2 are named because the only thing they attach to is the vertebral column itself. So there's the axial skeleton. Make sure that you spend a lot of time preparing for this lab before you walk in. You do want to be able to leave lab after this first period having memorized the bones. Remember, you can't take the bones home with you. The only thing you can do afterward is use images from the textbook and APR to study. So learn them the best that you can in lab. I would definitely recommend practicing writing out the names of each one. So bring in some scratch paper or a dry erase board and then quiz each other before you leave today. I hope this has been helpful. Good luck studying, and we'll see you guys in lab.